G'day guys, Luke here. Welcome back to another video. In today's guys, we're looking at part 3 of the common illnesses in reptiles. Today's guys, we're looking at is respiratory infections, eye infections, mouth rot, and scar rot. Apart from mites that we covered off in part 1, I find respiratory infections probably the second most common illness I see in reptiles personally. Some of the symptoms I look out for is the animal is off food, it's been lethargic, it's losing body condition if it's a bad case of it. Also, hear wheezing and crackling from the animal in question. You'll see excess saliva built up. I think there's also a thing called canker that sometimes will build around the mouth as well. And sometimes if excess saliva, it will dry up around the lips of the animal. And in the case of a snake, it's unable to tongue flick. What causes respiratory infections in reptiles is usually a combination of either bacteria, viruses, or fungi with a mixture of heating and humidity. So if you have kind of inappropriate heating, humidity levels, then you got a lot of bacterial enclosure. It's a good recipe for disaster. Sometimes respiratory infection can come across with stress as well as nutrition as well, but I find it's often the case it's the other problem you will get. So how do you prevent getting respiratory infections in reptiles? Make sure you got the appropriate heating and humidity level for that species that you have. If it's a nutrition issue, make sure you provide the appropriate diet, as well as having regular cleaning of the enclosure to prevent any bacteria building up and causing RI with your reptile. When your reptile does have respiratory infection, like anything else, go straight to a veterinarian who does specialize in reptiles who can aid you there. But if you needed to at least buy some time to get the money or trying to find someone who does do reptiles or even get to the appointment, there is a couple of home methods I do personally. So once I do know my animal does have RI, basically, I'll take the substrate out because sometimes the substrate can hold humidity. Paper towel and newspaper just to dry out the environment a little bit. A cave, a smaller water bowl because sometimes if I have a large water dish, can set it off as well. I might bump up the temperature from 32, so let's say 30 degrees Celsius, but then I'll bump it up to 32 just to help with the animal build up the immune system to fight off the infection. Then every day I either used to do one method, then I changed my method kind of a year on. My first method I used was getting a sealed plastic container, put the snake in a separate container that had air holes in it, got a jug with some boiled water, vapor rub or eucalyptus oil, mix that together, pop it in the container, in the sealed container with the snake, not in with the snake because you end up burning the snake and you got a new problem to deal with. After 10 minutes of the snake being in that container with that stuff, I take the lid off, to let some fresh oxygen to exchange, pop the lid back on and do another 10 minutes. And I'll do that daily until the respiratory infection is gone, or I'll go and see a veterinarian who can provide me the appropriate medication. Another method that I'll use now because it's more effective is the F10 in a nebulizer or fogger. I find personally the nebulizer works better as it just makes the F10 more of a Onto eye infection, as the name suggests, we're looking at the eye. Now, there's three main things I look out for when my animals have eye infections. Often the case would be pus in or around the eye. There's crusted eyes or the eyes of the lizard or snake. Well, not so much the snake, but the lizard is more watery. So what causes your animal to get an eye infection would be either an irritation from a claw or something's gone into the eye, substrate, stuff like that, or maybe it's rubbed its eye on something sharp or something in the enclosure in general. So it's irritated the eye to the point where bacteria has set in place and you've got an eye infection. I prevent the eye infections by checking any furniture I put in the enclosure to make sure the animal doesn't have really a big chance of getting irritated by that object, as well as substrate, to make sure the substrate I use doesn't irritate the eyes, and check the eyes quite regularly to make sure they're healthy, they're nice and transparent, and there's nothing, I guess, mysterious going on there. Treating an eye infection for a reptile, there's a couple of home methods I've used personally. Is I get some saline solution and just wash the eye out every now and again to make sure it stays clean, or use some eye ointment just to rub into the eye to kill any bacteria, and hopefully in a couple of treatments the eye is good as new. Sometimes if it's a very bad infection, like anything else, go straight to a specialised veterinarian who can at least have a proper look of what's going on. Next up we've got in the video is scar rot. Now this is something I haven't really dealt with personally. I've only probably seen it once or twice when animals came through work and I've gone, that's scale rot, because I don't personally see that often. So what are some of the symptoms of scale rot? So normally your scales will be discolored, they'll be raised and flaky, as well as there'll be blisters starting to form with scale rot. For scale rot to occur, normally you have to have a very dirty environment, as well being moist for your bacteria and fungi to survive. And basically once you get to the scales, unfortunately that's where scale rot starts to occur. Sometimes having trauma to the skin, especially burns from the heat source, can sometimes form scale rot with your reptiles. The only way to prevent scale rot in the first place is by having your enclosures regularly cleaned, as well as checking your moisture levels to make sure it's at the appropriate level for the reptile you are keeping. When your reptile does have scale rot, the only way of, treating it is either going to see a veterinarian who can provide a specialised cream that can help the animal recover. But mostly with your setup, I would just go back to paper towel, newspaper, keep it dry so at least the scales can heal up, as well having betadine to at least apply to the skin, being diluted of course. I think some of you guys in America call it betadine or something like that. So betadine, however you pronounce it. Sometimes that's the home stuff we can use just to hold things at bay until we see someone who can at least aid us in getting rid of scale rot altogether. So mouth rot has a lot of symptoms here. So normally symptoms would conclude of loss of appetite, pus and discharge coming from the nose and mouth, especially foul mouth, red and swollen gums, as well as open mouth breathing and a swollen face. So by the sounds of it, this is going to be a real kicker. When it comes to our mouth rot problem here, like anything else, it's always bacterial or fungi related. Weakened immune system due to poor husbandry, could be heat, humidity, dietary, stress. We have a lot of things that can cause your reptile to get mouth rot. Prevention for mouth rot is basically pretty simple by keeping your enclosure nice and clean, providing the appropriate husbandry for your animal, stress-free and appropriate diet as well. When you do have mouth rot, guys, I do suggest going straight to a veterinarian. By the sounds of things, this is a very serious problem, and this is something that needs to be pretty much seen immediately and taken care of straight away to prevent any further damage to your reptile. After you see the veterinarian, the only thing you can do with your reptile to recover from mouth rot is by having a nice clean enclosure, providing the correct humidity and heat levels, as well as giving appropriate diet and medication for it to recover nicely from mouth rot. That is part 3 done and dusted for this series. Next up we are covering off is prolapse, egg-bound, funguses and soft shell with turtles. But until then, thank you guys for watching this video. I'll catch you all in the next video.